Today's video on the impact of mental health on society. Effects on society of psychological disorders. While there are different cultures and nations with regard to the specific social consequences of mental illness, untreated mental illness has significant social costs. In 2001, the WHO estimated that developed nations cost 3–4% of GNP, brute national product, on mental health problems. In a 2018 report on mental health from Lancet Commission, mental disorders are increasing across the globe and are costing the global economy $16 trillion by 2030. The cost is mainly due to early mental illness and a loss of productivity, with an estimated 12 billion business days lost due to mental disease. A study from Harvard Medical School estimated in 1997 that the U.S. lost over 4 million working days and had 20 million work cutback days due to psychiatric illness. Furthermore, psychological disorders can exacerbate other public health problems, increase the burden on national economies, and prevent international efforts in public health. The WHO report says that around 13 million people worldwide are injecting drugs and 1,7 million are living with HIV, according to a WHO 2020 report. Around 10% of global HIV infections and 30% of non-African HIV infections are injected with drug use. In all parts of the world, the rate of regional HIV prevalence is high for persons injecting drug. Up to 15.5% in East and South Africa. Hepatitis C also affects people who use medicines disproportionately. It is estimated that 67% of people who inject medication have global prevalence of hepatitis C. Moreover, there are about 2,2 million co-infections of the HIV, hepatitis C virus worldwide, with more than half of them injecting drugs. Increased risk for non-compliance with other health conditions is also associated with a mental illness. For infectious diseases, unsuitable or incomplete medication use may lead to pharmaceutical resistance, which can deeply affect public health for the world. In addition to this, motherly depression can put babies at increased risk of low birth weight, problems of childhood health and incomplete immunization. While there are no dangerous behaviors for the majority of individuals with mental illness, violence and prison among people with mental illness can have considerable financial and social costs for communities and nations. Worldwide, around 10 million people are detained, and the World Health Organization, particularly among women, reports that the prevalence of mental health issues is very high. Almost 1 million adults with severe psychological disorders in the United States were imprisoned each year in the late 2000s. A study conducted in Pinellas County, Florida, has found that there has been a significant increase in the risk of miscarriages and days in prison and no ambulatory mental health treatment, and a further number of days in prison that is consistent with national incarceration statistics have been associated with substance abuse disorders. National 2002 Inmate Survey in local jails found that, compared with the general U.S. adult population, homelessness was significantly more prevalent among the prison population, and that homeless prisoners were much more likely than other inmates to have mental health and drug abuse issues. The authors suggest that, as a result of deinstitutionalization in the United States, which resulted in limited availability of psychiatric hospital beds and strict criteria for admission, the relationship between home and mental illness may reflect limited access to mental health services, particularly hospital services. In order to reduce the negatory effects of mental illness on patients and their local and global communities, WHO recommended that developing and developed nations adopt more comprehensive preventive and intervention programs. Follow us in the next video. With us, your health is better.